Hey Fruit Faces, hope you guys are doing great today. Rocky and I are just here to talk with you a little bit today about something that is completely off topic. I've done one video on it before, something that is very, very near and dear to my heart, and that is diagnosing autism and the early diagnosis of autism. I have done a ton of research. Rocky, you have to do that right now. I'm still learning new things every day, and that is why I made this video, and that is why I want to share with you guys exactly what I've been learning, because I have done, again, I don't want to say countless hours. That's a little dramatic. I mean, I've stayed up late nights worrying about this. Early intervention is best, and it's proven to make a huge difference in children's lives who have autism. It's funny because I've read blogs and different things before where they would say, oh, well, you can't tell an autism person just by looking at them. And so I kind of just took that, oh yeah, I mean, that makes sense. Like, they all look a little, the kids that I've known have kind of looked similar. I'm on spectrumnews.org right now, and it says clinical research, facial features can help diagnose autism. So this is old. I mean, this is old. This is from 2012. And they're saying that there are some main kind of characteristics that you can look for. Asymmetrical face is one of them that always gets brought up. If they have an asymmetrical face, sometimes the eye will be up higher, asymmetrical mouth, tufts of hair growing in wrong directions. Sometimes they call it an odd swirl or something like that, and a prominent forehead. Obviously, if you have one of these things, it doesn't mean anything. But if you are having some autism signs and symptoms, red flags and whatnot, and then you can look at these dysmorphologies is what they call them, it's important. And they say, of course, the more of them that you have, and that's not all. Wide set eyes is one of them, or just wide eyes in general. Deeply set eyes. Really, expressionless faces is huge. Again, that's something that I've noticed in all of the children. A thin upper lip is also one of them. And interestingly enough, a lot of these coincide with fetal alcohol syndrome. They're trying to find out in this study if it could really predict if a person has autism. And they're saying yes, on average, children with autism have at least one or one and a half major abnormalities and 10.6 minor ones. So again, it's just like any other autism symptom. It's not like, oh, they have this wide forehead, they're autistic. This is like adding it up together, and it can be a sign. They said using 6 or more of these common variants as a cutoff for autism diagnosis accurately diagnose 88% of children with autism. And that's just one of the articles that I had. Of course, I had to go and look up some more information about it. The deep set eyes kind of has a couple of different features. Sandal gap toes, or like even if they're like fused toes. High narrow palate. Attached earlobes is one. Hypermobile joints. Brachycephaly is a shorter skull. Short head, mouth asymmetry, eye asymmetry, earlobe crease. So if there's a crease, they call it train track ears. If there's a crease down here and then kind of goes all the way around, like that's a sign as well. A large mouth, again, limited facial expression, open mouth, prominent lower jaw, or I've seen the opposite if it's like a very small type of lower jaw. So yeah, these are just some of the things that these different studies are finding, and there's more. If you look at they're saying that again, it sort of goes with fetal alcohol syndrome. A lot of those are the same. So epicanthal folds are, if there's like skin that basically covers up the pink part in the inside, how you have like, okay, that where the eye boogers get, there's like basically a covering on that would be a pronounced epicanthal fold, and that is definitely a sign and something that I've noticed in all 3 of the children that I knew. A flat nasal bridge. So they're, if you look at them from a side profile, it's almost like their nose just doesn't stick out very far. It just, and especially right here, it's very, very flat. And that is, again, something that I've noticed in all of them. Okay, this is another one. Palpebral fissures. Oh, that just means like the opening. So it's kind of like, almost like squinty eyes. It's like the fissures are on either side. So if you kind of have almost like squinty eyes a little bit, that is also a sign. Railroad track ears, upturned nose. I haven't seen upturned nose so much. That's more of a fetal alcohol syndrome one. This one is big. I always see this in these articles. A smooth philtrum. Your philtrum is right here. And you see how mine is kind of deep. I mean, relatively. It's not super deep or anything, but it's this little gap right here. And in all of the kids, again, that I've seen, it's very, very smooth. It's almost like pronounced, or it's like wider. It's a little bit wider. So, and then again, the thin upper lip. Let's see what else we got here. If anybody's interested in this, I do have a huge amount of information on my Pinterest board. You can look up not claryberry.com. You can go to claryberry.com if you want to, but if you want the autism stuff, go to Claryberry on Pinterest. It's the same spelling except for it's put together, one word. And you can go to ASD board and follow that if you want to. Oh, a lot of them are saying like you have a big forehead and then this part of your face is kind of scrunched up, and then maybe perhaps a longer like bottom part. Again, it's just kind of like scrunchy here. Okay, the head size again is one of those things. It could be either or. It could be bigger or it could be smaller. A lot of times at birth it's going to be bigger, and then later it's going to be smaller. Broader upper face. So the upper face is broader compared with typically developing children. Shorter middle region of the face, including nose and cheeks. The wider philtrum. So the more severe your traits, the more distinct your facial differences are going to be. So yeah, I think that is about it. I just wanted to, let people know, because if you are worried, and don't think that, oh, I went to the doctor and I mentioned it, or I've been talking to my doctor and seeing a doctor, this whole time, like, don't think that that is automatically ruling it out. Again, like I said, because they could be looking for certain things at certain ages. Sometimes it's more pronounced later on, there may be regression, or it develops over time. Also, again, these doctors a lot of times aren't necessarily skilled or trained in this or thinking along that level, So definitely, if you feel like there's a problem, and even if you already had somebody say, no, I don't think it is, don't necessarily take their word for it. Like, follow your gut and go see an actual psychologist or actual, neuro doctor or whatever. There's a lot of different resources that you can use. So I just wanted to share this because, again, it was just something that I had never really heard before. Mildly down slanted palpebral fissures. So if your eyes are just kind of slanting down a little bit. So share this video so people can, help to learn about this, and maybe you can make a difference, because early intervention and diagnosis really does make a difference. And it's not fun for anybody to realize, wow, at 4 and 5 years old, like, I found something out about my child that I could have helped them better at 2 or 3 or even younger. And it is possible to diagnose at a very young age. It's also talking about like larger doe eyes. But anyway, yeah, you might change somebody's life. So take care, look it up, do your research, be smart, don't forget to eat your fruit. I'll talk to you guys soon. Thanks.